Guess we'll wait another 5 minutes.
Good afternoon, commissioners.
Good afternoon. How's it going, Raul?
It's going well. One day at a time, right, Yvette? How are you doing, Ramales?
Hey, how you doing?
I'm doing
Linda?
good.
Yvette, how's everybody?
Good.
I know I see Jamie's on and so is Armando. Hello, everyone.
Good afternoon, everyone.
Commissioners?
So far, it looks like just you and I, Yvette.
Yeah. Any
We
other?
are waiting. Yeah, we are waiting for a couple more commissioners. We're waiting for Astrid and Robert.
Okay.
Okay.
Well, we have 4 minutes left. Oh, no, 2 minutes according to my iPhone.
Hello, Astrid.
Hey, how are you?
All right.
I just want to be where Armando is.
Hello, John.
Mhm.
Oh,
Hi, Commissioner.
sorry. I thought you were at the beach, so.
Yeah, that's actually, that's in Portugal.
All those fake backgrounds throwing people off.
This is where I really am right now,
Yeah.
my home office.
Well, I've started coming into my office 3 days a week, which I really like. I know people like working from home, but I do not. I like having a professional environment.
Well, and you're looking very professional, Yvette, so.
I mean, I'm so done with working from home in sweatpants. I'm just,
Yeah.
2 years of that was a nice break, but you know, it's time to get back.
Well, it's good to see you. And Astrid, how are you feeling? How are you doing?
I'm feeling good. I'm feeling
Yeah.
fine. I actually ended up not having COVID, but having what I didn't get immunized against, which was the flu.
Oh, my heavens.
Oh, wow.
Because I was
Heavens.
like, I've been punctured so many times now. I'm sure I won't catch that.
Yeah, yeah.
I was
Well,
like,
we're glad you're feeling
I'm fine.
better. And
I'm
Commissioner
good.
Taylor, good to have you as well. I think we have 3 commissioners who are holding up, standing on the shoulders of the board or representing the board broadly, but we're delighted to see you all and be able to jump in today's meeting.
All right.
Glad-
Are we
Glad
expecting
to see you, Kim.
any other commissioners?
Linda, let's turn it over to you.
We are waiting for Dr. Bird to join us,
Dr. Bird is joining us. Okay.
Okay.
but he is a non-committee member. But he
So-
is joining us.
Should we get?
Maybe about we could get started. Linda's going to have to do her kind of tee up in terms of ground rules as she does before any public virtual meeting.
All right. Well, take it away, Linda.
Thank you. Good afternoon, commissioners and members of the public. I'm going to begin with some important information today under AB 361. As you know, members of the First Federal Board of Commissioners or staff may continue to participate in this meeting via teleconference during declared emergencies through January 1st, 2024. In the interest of maintaining appropriate social distancing, members of the public may observe this meeting telephonically or otherwise electronically as posted on our website and this agenda. Now, regarding public comments, there are two ways to submit public comment. And the first way is written public comments must be submitted in advance of the meeting via email to me at lvo@first5la.org. And it has to be done by 2 p.m. the day of the meeting in order for them to be read aloud during the meeting. Now, as a reminder, public comments emailed should indicate the item number the comment corresponds with, and any public comments received via email after 2 p.m. will become a part of public records. Now, during the meeting, public members can also use the Q&A chat function to express an interest in speaking to an item. It is important that these requests to speak be submitted via the Q&A chat box before the item being commented on is presented. And when submitting requests to speak, public comment should be indicated with an item number that it goes with, and all public comments received during the meeting via the Q&A chat will be addressed in the order they are received. And when you do hear your name called to provide public comments, you will be given the ability to speak during the meeting. And if we don't hear you begin your comment upon your name being called, we will call your name out one more time before moving on to the next public comment. There will be 2 minutes allotted for each comment. And once 2 minutes have passed for each item, we will move on to the next public comment. And before we actually begin the meeting, just a quick reminder for everyone to minimize background disruptions by just placing your lines on mute until you're called upon to speak, and to minimize multiple people speaking at the same time, and to ensure for a coherent dialogue. If members would like to speak to an item or have a question, please use the hand raise function or chat box, and Commissioner Martinez will call on you in the order that she sees you. And a reminder to board members that if there are any technical assistance required during the meeting, you can contact me at 213-276-9389, and I can connect you with IT. And with that, I will hand this meeting back to our Budget and Finance Committee Chair, Yvette Martinez.
Thank you so much, Linda. Just so everyone knows, this will be my last time chairing this Budget and Finance Committee meeting. So thanks. It's been great to know the wonderful team at First 5 LA who prepares and works on all of the financial analysis for all of us. It's been great, a really good learning opportunity for me. So with that, let's go ahead and do roll call.
Linda Aragon. Romalis Taylor.
Here.
Astrid Hager.
Here.
And Yvette Martinez.
Here.
Quorum is present.
Excellent. I see there were a number of memos in the meeting packet. I hope everyone had a chance to review them. I myself did a briefing with the finance team this past week, which was really helpful, and I got a preview of the PowerPoint presentation. So with that, I'm going to bring up Raul and Daisy to present the proposed 2021-22 revised budget. And they have a long-term calendar to review and the PowerPoint, which is really excellent for us. So Raul and Daisy, do you want to walk us through your presentation?
Thank you, Commissioner Martinez. And before we get started, as the Director of Finance, I just wanted to acknowledge your leadership as our chair at the Budget and Finance Committee for the last couple of years. And I really appreciated your partnership and the way that you work collaboratively with us, and not only with me directly, but with the entire team. So I thank you for your participation. And I know that you've invested a lot of your personal time in a lot of our one-on-one meetings. So I really do appreciate it. And thank you for that. So that being said, welcome all to the first Budget and Finance Committee meeting today. We are going to be covering the mid-year fiscal year 21-22 mid-year revisions. And in addition, we will be providing you at a very high level the calendar for the rest of the mid-year process and for the fiscal year 22-23 budget development which also includes an update to the long-term financial plan. Before I do pass it on to Daisy, I just want to remind all of us that in fiscal year 2021, when we were developing and preparing for this budget, we were working under the ongoing COVID-19 pandemic. And obviously in 2021 and continue in 21-22, the pandemic continues to drive a lot of the changes that we are proposing to you. There was a lot of uncertainty. Most of our proposal and adjustments for the mid-year is really grounded in on those, what we knew at the time under those circumstances related to the pandemic. So please keep that in mind when we do look at our adjustments for this fiscal year 21-22. Not only do we partnership directly with our program officers who are really driving the work to get a better understanding of what's driving those reductions, but we also look at our history, and we ground a lot of our changes from the prior year learning under the pandemic, and we bring them forward into how we look at how we may be proposing some adjustments for this year. So for that, with that being said, I'll pass it on to Daisy to go, as Yvette said, a very thorough presentation, and take it away, Daisy.
Thank you, Raul. Just to confirm, can everybody see the PowerPoint presentation? Okay, wonderful. Yes. Wonderful. Okay, so yes, thank you. Thank you, Raul, and thank you, commissioners. Welcome staff. Today, as Raul noted, we will be discussing the proposed mid-year adjustments to the current fiscal year 21-22 budget. And although our presentation is focused on our fiscal picture, we would like to emphasize that this process is reflected of the strategic priorities that guide our work, including but not limited to sustainability, which is a strategy that is included in our 2020-2028 strategic plan. So today's mid-year budget adjustment overview will address the key budget adjustment takeaways or themes, review of the commission budget touch points, an overview of the mid-year purpose and process, as well as a summary of the board approved policy for this process. We will also cover a high-level assessment of the mid-year adjustment impact to the overall fiscal year 21-22 budget, including program and operating adjustments, and an update on our revenues before we close with next steps in this process. So we begin with some key takeaways summarizing this year's adjustments. As Raul mentioned, the nearly 2-year-long COVID-19 public health emergency has impacted activities originally proposed for fiscal year 2021-22, both with augmentations to respond to the various needs triggered by the pandemic and decreases due to obstacles and challenges posed by the pandemic in executing activities as originally expected. Budget estimates were also updated to reflect new information or changing circumstances, including project timeline reassessments and alignment to actual spending trends consistent with previous years. And finally, demonstrative of our continued commitment to partnerships, collaboration, and less reliance on Proposition 10 funding, we have received additional funding to support our work in home visiting and Black infant health, specifically the African American infant and maternal mortality communications work. We will see and discuss these themes further as they arise throughout the presentation. So as reflected in this graphic, the key commission periods related to the budget development begin in May, when the fiscal year budget for the following year is presented to the commission as an information item, followed by the presentation of the fiscal year budget as an action item for approval sometime in June. Mid-year adjustments are presented to the board in February, with action anticipated for March. As indicated in this timeline, we are meeting with you today to discuss the proposed adjustments to the fiscal year 21-22 budget. We will then present an abbreviated high-level version of this presentation to the Board of Commissioners this coming Thursday, February 10th, as an information item, with action taken in March as an item on consent. Now we would like to briefly remind you of the purpose and process driving the mid-year adjustments. The purpose of the mid-year adjustment process is an opportunity to refine both the program and operating budget estimates based on any new developments since the budget was originally developed several months prior. It's also an opportunity to communicate any changes to the revenue. The adjustments to the fiscal year 21-22 budget include both increases and decreases to spending based on additional analysis, actual spending rates, and updated needs assessment for the remainder of the fiscal year. Our process adheres to the guardrails that were outlined by existing budgetary board policies. Consistent with these policies, we are required to bring any and all program budget changes to the board for approval. Also consistent with this policy, we are required to bring all operating budget line item adjustments of $25,000 and over to the board for approval. And based on these policy parameters, the fiscal year 21-22 mid-year revised budget will be presented for the board to the board for approval, as previously noted. For fiscal year 21-22, the budget estimates were updated to reflect new information or changing circumstances, including most notably due to impacts of due to the ongoing COVID-19 pandemic and impacts to funding and timelines. We also see updates that reflect the receipt of additional funds, as I just noted, as well as alignment to actual spending trends and timeline shifts. So now we're going to take a look at the impact of these adjustments to the fiscal year 21-22 budget. This table reflects the results of the 21-22 mid-year adjustments at a high level. We will be diving into a deeper discussion of the primary reasons that inform the adjustments to key activities within the 2020-2028 strategic plan and the operating budget. But first, we will discuss the high-level impact to the 21-22 budget, including adjustments to the legacy investments and emerging opportunities. So the outcome of the mid-year process is an overall net decrease of approximately $3.9 million in anticipated expenditures for fiscal year 21-22. The downward adjustment to the program budget translates to an approximately 4.21% net change to the overall fiscal year 21-22 program budget. Adjustments to the operating budget represent movements of funds between line items and cost categories based on updated assessments of need for the remainder of the fiscal year, the net result of which is lower than originally anticipated spending, with a net downward adjustment to the overall operating budget. And we will review the shifts in the operating estimates a little more closely in a few minutes. The adjustment to the 21-22 program budget is driven by shifts in spending across various initiatives and line items, but is the result of a net downward adjustment across all overarching budget components, including legacy investments and emerging opportunities fund. The legacy investments represent ongoing work of the Commission, which are naturally sunsetting, and there are only 2 remaining legacy investments, baby-friendly hospitals and Little by Little. The mid-year adjustment to the legacy investments is due to the additional funding Little by Little obtained from another source to offset First 5LA's investment in their continued effort towards sustainability. Our next budget category is Emerging Opportunities Fund. This centralized funding is intended to support emerging opportunities or needs in the fiscal year. The downward adjustment to the Emerging Opportunities Fund is due to year-to-date spending and anticipated needs in the remainder of the fiscal year. So as of today, no requests have been made against the emerging opportunity funds, and no resources have been spent in this area of the budget. Additionally, based on conversations with leadership across the organization, little, if any, of these resources are earmarked for use by the end of the fiscal year. Spending from this source has been below or approximately $200,000 in the past several years, including last fiscal year, when $3 million was proposed for spending due to the COVID-19 pandemic, but resources were adjusted downward to $215,000 at mid-year as the COVID-19 support funds were drawn from the individual programs within the 2020-2028 strategic plan budget. So we do anticipate that the $200,000 balance should suffice for the remainder of the fiscal year. Now we will take a closer look at the adjustments driving the remaining budget components, beginning with the estimates in support of the 2020-2028 strategic plan. This table highlights adjustments at the center, office, and team level for the Center for Child and Family Impact, the Office of Government Affairs and Public Policy, the Office of Communications, and the Office of Data for Action, resulting in a net downward adjustment of just over $1.6 million. Although there are no proposed net adjustments for family supports, they are proposing adjustments to various programs. Downward adjustments to reflect spending trends for the fiscal year are captured, as well as an upward adjustment to Welcome Baby Impact Study based on the inclusion of delayed deliverables from the previous year and additional data collection activities. So the detail behind all of these adjustments can be found in attachment 1A included in your materials today. The communities team and center support are not requesting adjustments to their board approved budgets, as resources are anticipated to suffice for the fiscal year. The $159,000 decrease to early care and education systems is primarily due to a partnership with a school district that is no longer being pursued due to numerous unsuccessful attempts for contact and engagement. So these resources are being adjusted downward. The $10,000 increase to health is due to the receipt of external fundings, $225,000 from the Los Angeles County Department of Public Health to support the African American Infant and Maternal Mortality Strategic Communications Initiative. This additional funding was offset by decreases to Help Me Grow and First Connections. Decreases to the Office of Government Affairs and Public Policy and the Office of Communications are largely due to limitations for in-person public events and conferences, thus resulting in downward adjustments. The downward adjustment to the Office of Data for Action is primarily the result of delays in data strategy development due to staffing vacancies and implications of these delays to interrelated projects. Additional information and context related to this component, as I mentioned, is documented in attachment 1A, and additional information can also be found in the mid-year memo. So turning to our operating estimates, the operating budget represents the personnel and supplies and service costs required to support and advance the work of the organization. Consistent with past practice, the budget projections and any necessary adjustments are prepared at the department level, or at the team level, which roll up to the agency-wide adjustments presented in attachment 2. Included in today's materials, and this is the operational cost summary for the year. This detailed analysis allows for a higher degree of due diligence to ensure the budgets are monitored and managed at the appropriate level, as well as to best inform the development of the fiscal year 22-23 budget, which is currently under development. So as mentioned earlier, the downward adjustments across nearly every operating cost category resulted in a net decrease of roughly $27,000 to the overall budget, chiefly influenced by the COVID-19 pandemic. The greatest impacts to the operating budget appear within personnel services, professional services, and the travel expenses cost categories. The personnel services was adjusted to repurpose a portion of staffing vacancy savings to offset costs in other unexpected line items, such as consultant costs, offsite storage, and hardware needs. Additionally, a percentage of the IT director's salary was reclassified to the Center of Excellence budget, as the IT director has been assuming a dual role this fiscal year as director of IT and as the interim chief operating officer. The professional services category reflects a net upward adjustment in costs of approximately $49,000, which is primarily the result of an increase to web-based services and the need to purchase a module to help the organization track COVID-19 vaccination records for First 5 LA employees. The downward adjustment to travel expenses is, again, the result of the pandemic. The original budget development guidance restricted travel for the first half of the fiscal year 21-22, with limited travel anticipated for the second half. With the emerging COVID-19 variants and guidance from local and national health experts, business-related travel for the remainder of the fiscal year seems unlikely. However, some resources remain in this cost category in case of any changes. So again, the net impact to the anticipated operational costs for fiscal year 21-22 is approximately a $27,000 downward adjustment. And additionally, just to note, proposed adjustments to the operating costs did not affect the total approved administrative cost limit of 14.1 million for fiscal year 21-22. However, as a result of the previously mentioned adjustments in program spending, the percentage relative to annual spending increased from 12.37% to 12.81% of the total budget. Illustrated in this table is a summary of changes in anticipated revenue for fiscal year 21-22. Our Proposition 10, Proposition 56 backfill revenues are grounded in projections received from the California Department of Tax and Fee Administration, also referred to as CDTFA. However, we amended the total to capture an internal 1% downward adjustment to account for the trend in revenue shortfalls or payment inconsistencies, and to provide clarity related to the methodology used to calculate disbursements. So the first revenue estimate column in this table reflects the total projected revenues for fiscal year 21-22 as shared in the long-term financial plan in July 2020. In July 2021, for a total of just over $69 million. The second revenue estimate column reflects the revised estimated revenues with a projected increase to Proposition 10, Proposition 56 funding per the latest projections from CDTFA, as well as additional funding from the Los Angeles County Department of Public Health and a Medi-Cal managed care plan totaling $435,000 received after the approval of the fiscal year 21-22 budget, for a revised total of nearly 85 million in projected revenues for fiscal year 21-22. So this does represent a roughly $6 million increase in anticipated revenue for fiscal year 21-22. These funds and corresponding expenditures were not captured in the original budget due to the timing of receipt of funds. And we are highlighting these funds since we're using the mid-year process to reconcile and align earlier fiscal year 21-22 board action to this year's revised budget. So this table further breaks down the nearly 435,000 in alternative funding identified for receipt after the approval of the budget back in June 2021. And again, this includes Medi-Cal managed care funds to offset our investment in select home visiting programs and welcome baby hospitals, as well as funds from the Los Angeles County Department of Public Health to lead a strategic communications initiative in support of the countywide birth disparities work which is in our health systems budget. So our next step in this process is to present these adjustments as a high-level information item to the full board at this Thursday's February 10th board meeting before submitting the materials for final approval and consent at the March 10th meeting. We will also update the LTFP with the revised fiscal year 21-22 budget estimates and revenue updates. And these changes to the plan will be shared with the board in conjunction with the fiscal year 22-23 budget in May and June of this year. Additionally, we will use the revised budget and updated information on actual spending levels to evaluate and inform the fiscal year 22-23 budget, which is currently under development as we continue to move forward toward greater alignment between our fiscal realities and strategic imperatives. And that concludes this presentation. We appreciate your time and welcome your feedback.
Thank you very much, Daisy. As always, really comprehensive and easy to follow and understand. I have a question on the declining Prop 56. I'm sorry, the increase in the Prop 56, the $6 million increase. Where is that trend coming from? Any idea?
So the trend is actually grounded. Well, there's several things that's going on with Prop 56, Commissioner Martinez. It is a backfill component based on the passage of that additional tax, and so it comes a year after the fact. So the backfill is actually for the prior year.
Okay.
But the fluctuation in Prop 56 is there's several things that are happening. Consumption and birth rate, just like the fluctuation when it comes to our regular tobacco tax. In addition, there was a reconciliation that CDTFA had to do when, because Prop 56 is a new backfill component that started 3 years ago. So if you would look at the trend, that first year was very, very low, and then there was a huge fluctuation. So it's this weird, we're in this weird timing where it's adjusting
behind,
based on prior and then what's actually happening.
I remember that one year when it was a huge decrease. So, okay, I understand that. Thank you.
Yeah.
Okay, it looks like Ramalis has a question.
Yeah, this is for Ro on the revenue.
Yes.
Mr. Ramalis, can you?
Commissioner Ramalis,
you're on mute.
Oops.
I'm saying, my question is on the revenue. You're projecting $5,144,000 in this year for other revenues. And I've come to understand that we've already realized that revenue in the prior year budget. So why are we reflecting it in this projection? of estimate?
So, so to answer your question, based on the conversation that we had earlier prior to the meeting, it's more because the way that we're presenting it today is under like the gap in the way that we approved our budget process. We did highlighted the 5144 in doing the budget process. So what we're trying to highlight for the mid-year revision is what is it that we didn't know when we approved the budget back in June, which is those two resources that Daisy highlighted that came out to a little bit over $435,000, which is related to the Medi-Cal management care and then the LA County Department of Public Health related to our AIM project.
Okay, so this is just for presentation purposes, because I
Yes,
noticed
sir.
for attachment 1, you eliminated the $5,144,000 because it was received in the prior year, right?
It is because of the timing and when we showed it already. So we already showed it in the approval of the fiscal year 21-22 budget.
Okay, all right. I just hope that we're going to footnote that in your attachment 1.
We could do that, sir.
Okay.
Okay, are there any other questions from commissioners or members? Staff or anyone else have questions?
This is Romales again. I just have one question. I know that, and this is really for John and Kim. This issue about this projection of cuts down to $200,000 for unanticipated possible projects or something that can be done. Are we being way too conservative in that, or you're comfortable with it? That's all I need to know.
I'm happy to start a response, and if Kim has anything to add, certainly defer to her. I did, through the mid-year budget adjustment process that finance leads, we did have an opportunity to check with all of the directors. And one of the reasons we are maintaining the $200,000 is, as you and the other commissioners know, we have sent significant resources over to the California Community Foundation, which is managing a pooled fund to respond to COVID. So a lot of the supports we've been giving our ECE providers are actually coordinated through that fund. The $200,000 that we reserved in our emergency opportunity fund after we took that reduction, we feel is more than adequate, given the other resources that the board has already supported and adopted. And the reason we are keeping those dollars is for the remainder of the year if there are unforeseen costs. For example, sometimes there might be warehousing costs for supplies if we're distributing masks or something like that. And speaking from a CCFI or the Center for Child and Family Impact, we feel that $200,000 is enough to be able to be responsive given the rest of the year.
I just wanted to make sure you're comfortable with that, and if, you know, that we're not being too conservative, so that you have flexibility to address whatever's coming forward.
Yeah, I appreciate you lifting, the questions regarding the Emerging Opportunities Fund, Romales, and really want to commend Raul and Daisy for their due diligence in terms of bringing an organization-wide perspective and engaging John and other partners relative to what our experience has been in the past, our experience this fiscal year, to inform the adjustment recommendation that you have before us. So we, stand arm in arm as a team, and we do so, recognizing that Raul and Daisy are bringing an organization-wide perspective to these mid-year adjustments, and the recommendations reflect the product of some strong collaborative work across the organization.
Okay.
And should there be, God forbid, another public health crisis or something else, we can deal with it as an emergency when it comes our way. All right.
Raul, you want to speak directly to that?
Yes, we do. As a policy, our organization has adopted a reserve policy. So if in case there was an emergency related to a shortfall in revenue or a delay in revenue or any type of catastrophic situation, and I would consider the pandemic as one, we can go back and tap into those reserves.
Okay.
So yes, we do have resources aside for those type of situation.
And can, if needed, convene the board on an emergency basis and solicit your feedback to our presentation, thinking, recommendations, which is effectively what the board did so helpfully.
We did that at the
early in
beginning. Yeah.
Yeah.
At the beginning of the pandemic, we
Yep.
did convene an emergency, and we can do so again if that happens.
Yep.
Okay. Well, this has been a great presentation. Any other questions from staff or members or?
If we could just go through our timeline, which is our next portion of our presentation today.
Calendar, great.
Yeah, the budget and finance calendar.
Okay, Raul, you'll walk us through this? Or do you want me to?
Walk you through it. Daisy, you're okay with me taking it, right? All right. So I want to take it from you. All right. So on an annual basis, we always propose a budget process, which we call the budget calendar. And as you see on the top section of this table, we covered, and Daisy covered in her closing remarks, the next steps, the fiscal year 21-22 mid-year revised budget process. So as today we will wrap up our meeting. That is our check against the Budget and Finance Committee. The next stop would be at Thursday's commission meeting, and then on to March with the consent item for the board to approve the mid-year proposed budget amendments. And then the second section that you will see calling out in bold italics is the fiscal year 22-23 budget development. I would say there's a lot of internal touch points between us and the organization and staff. Finance doing its due diligence and partnerships across the organization with the different centers. And really what we want to emphasize is the May through June process, which that's when it starts touching the different commissioners in their role. The first one being in May 2022, this coming May, which we will present the proposed budget at the Budget and Finance and the Executive Committee meeting. The Budget and Finance Committee has the purview of the overall budget, and we do invite the Executive Committee because they do have purview of the organization staffing and the operations. So that's why we invite both committees together for that review process. And then as normal, we come to you as an information item in May, and then we'll take it back in June as an action item. So this is not, this is more of an information item for you guys, but just for you to be aware of the different touch points that we have coming ahead with you all.
Okay, thank you for that. Any questions about the timeline or the calendar? All right. Linda, do we have any public comments?
We do not have any public comments.
All right, well, that was a very quick and efficient meeting. Let's see, I have 2:39 on my meeting. Any other items to consider or comments from anyone? With that, I think we are done and we can close this meeting. Thank you very much, everyone. Nice to see you on a Monday.
Thanks, everyone. We'll see you on Thursday. Thank you, Yvette.
Okay,
Thanks,
bye.
commissioners. Bye-bye.
Thanks,
Thank
everyone.
you.
Thank you.
Thank
Good
you.
job.